So going back to I didn't get in this to be rich, but I also deserve to be paid fairly. Do you think there might be tension in a physician's mind between honoring the Hippocratic Oath and then making a really good living for your valuable services?
I don't think so. I don't think it's about the Hippocratic Oath and really making sure that we do the right thing for the patients and their families at the right time. I do think there is some more injury that does occur in some fields and situations at an individual level that they perceive the system and the care delivery models that we currently have to basically disempower them from doing the right thing for that individual
Mm,
level. So there is, I think, a lot of skepticism and mistrust of the transparency of where all of the dollars are going. And there have been obviously many books that write about this, right? In terms of, well, if this $1 billion industry really is compared internationally for like how money is spent for where the dollars are going from either supply chain or salaries or personnel or HR or CEOs, I think there is some skepticism from the front lines that they can really negotiate in good faith for the right moral value, if that makes any sense. But I don't think it's the
mm,
Hippocratic Oath um, that most physicians are struggling with. I think it's more of the distrust and again, you don't know what you don't know, right? You don't know the books really. You can't really read the uh, profit loss statements and the cash flow statements of a whole system. It's overwhelming, and you're not privy to some of the information. So it's really hard because you don't own your own practice. That's why I think for many physicians and many going back into direct primary care, they're choosing differently over the last decade because the lack of transparency makes it challenging for them to morally be able to work in that kind of environment to advocate for their patients.